Hello everyone, this is Dr. Van Merkel, and we are going to give you a presentation today on preparing for COVID and future pandemics. I am Dr. Merkel, President and founder of ScienceBased Nutrition, and we're going to get right into it. In July, Fauci said essentially there's no end in sight to COVID, to the pandemic. And it was predicted way back in July that the winter would be worse for COVID and flu. They called a bleak outlook for fall and winter. And they still predict it's going to be one of the most difficult that we've experienced in American public health into 21. Who knows how long it's going to last. But are you ready? Are you prepared for another quarantine? Now, my practice in April, May and June, when it was a primary COVID thing, we maintained 76% of our business over 2019. And then we did some special marketing in June and July. We were higher in services than the year before. We did special marketing, which really works, and we'll share this later. But could your practice survive another shutdown? 90% of my practice does not require a physical presence by the patient. 90%. So when COVID hit us, it was no big deal to carry on as usual because that was the way our practice was designed, 90%. And look at that. Let me renew again. June and July were higher this year than 2019. I think it's because of the marketing that we did, the special marketing. Start now to prepare your practice for the next pandemic, which we're in right now. So in the next few minutes, we're going to show you an introduction to telenutrition, what science-based nutrition can do for your practice, tips and tools to get started, and specific marketing plans that I use in my clinic. I have 3 associate doctors, and I'm going to give you at least, I think in the advertiser said 2, I'm going to give you 3 solid marketing tips that will be presented. These are ones that work. We've used them in our practice many times, and we're currently using them now. So these are not just some, hey, hopefully it works. These will work if you will do, if you'll do what we recommend. That's simple. So, special notice, my county a couple days ago has just been given a 4-week voluntary lockdown, and we're required to wear a face mask. And we're told to limit or skip Thanksgiving, Christmas gatherings this year. I don't know what's happening in your community, but that's where it is right now. And they're trying to say they're trying to be nice, so it's voluntary, and people, and as COVID doesn't get worse, the hospitals don't get overloaded, we won't go to mandatory lockdowns. So I hear on TV, see on TV that some areas are even more stringent than what ours is. But people are more hesitant to travel and visit doctors' offices, we know that. And telenutrition is possible. We've been doing it. SBM members have been using it for over 20 years. And many other SBM members breezed right through this recent COVID-19 using SBM, and some actually did even better than my office did. I'm excited for them. But they are already trained, they've been using it, so when it happened, no problem. It's not necessary to see the patient provide much needed nutritional health care. Of course, it is always preferred to see the patient, but at times it's not possible. In fact, healthy people don't die from COVID. Zinc and vitamin D are known to be a benefit for patients to survive and avoid COVID. And laboratory tests can easily identify other deficiencies and balance toxicities. And testing through SBM is easy and inexpensive, and people will pay cash out of pocket. Now, when I say our practice did better this year than 2019, in 2019, my practice with three associate doctors, we did $1.75 million. We're 100% cash. We file 0 insurance. And people will pay cash for this, 1.75, and we're on track to do better this year. So it's one of those things, you might think you have to do insurance, you don't. People will pay for what they see as a value, and they will gladly pay for it if it does the job. And with SBM and training you'll receive, you can do this too. So SBM provides all the tools you need mean, we're going to give you training, marketing tips, where I'm also going to try and sell you into utilizing SBN, Science-Based Nutrition. We have a platform to run your business and to do teleconsultations and report of findings. We have the most advanced color coding reporting system. The analysis recommendations are comprehensive, it's objective, results are easy to see, the report is easy to understand. Ongoing online training. The SBN support team is always ready to help and assist you in providing SBN to your patients and community. SBN Technical is ready to help you with those tough patients. You're not out there on your own with SBN. If you get some tough cases of cancer, lupus, MS, Crohn's, whatever you have, you've got backup. You're not out there by yourself. You got somebody to help you out when you need it. We're not here to run your practice. We're here to give you a hand when you need it. SBN is proven, system, proven results, established for over 25 years. It's cloud-based technology, and we have the most advanced patented program, and we have always ongoing support and training. Experience and proven results, back up your tough cases. We have great discounts. The best discounts on pricing through LabCorp, Quest, and Doctor's data. Truly the best pricing, and we tested that last year and or checked it, and we are the cheapest prices for LabCorp, Quest, and Doctor's data. With a high level of practice, with the high technology we have with SBN, you're able to have reduced staff, and you have a high perceived technical practice, and you have tech support and training for doctors and staff. So what does a telenutrition practice look like? Well, it's pretty easy. Patient calls to schedule an appointment, and then the SBN member, you, would send a link, computer link to the patient to fill out their personal patient symptom survey. We call it the PSS. The PSS results are automatically uploaded to the member's personal PMA, Primary Metabolic Analysis website, for the member to use and review while doing their first patient consultation. Then you, the member, recommends testing. You collect payment, provide the patient with test orders and the requisition form, etc. The test results are automatically synced with LabCorp, Quest, and Doctor's data when you use our account. So reduced data entry, reduced errors here. And the SBN member generates a full color-coded nutrition evaluation utilizing as much information as there is: the patient symptom survey, the medications, the vitals, and their lab test results. The SBN member then downloads and reviews the report, completes a final thoughts, finalizes the final vitamin recommendation list. The SBM member electronically sends a report to the patient, completes a virtual review of findings. Then you, the member, can drop ship the vitamins directly to the patient from the SBM store, have the patient come to the office, and staff members take them to the patient's car. That is what we did. Earlier this year, all of our consultations, new patient consultations, were online. The staff my staff would send the requisition forms, take care of the rec forms for the blood, the hair, the urine, whatever is needed. And the patient would get the testing done, the results come to SBN, the report is generated. Then the doctor, the member, goes over the report of findings with the patient. The patient has had their report, SBM report, emailed to them. Now when I say email, we have a HIPAA compliant system part that SBN uses, that we use, so we can, email's not HIPAA compliant, but we have a special system that can be used that is HIPAA compliant. The doctor goes over the reports of the patient, and then there's nutrients recommended, and the patient can come to the office, and what we did, our staff took the vitamins to the patient's car. Or you could have the vitamins drop shipped directly to the patient, whatever you want to do. And SBN can easily help facilitate all of that. So how much does it cost a patient to get tested? Well, if they're doing our basic panel, and I'm not going to go over the complete test, but it's about 70 tests, and it's going to run, your cost is going to be about $120, a hair kit, $75, stool kit, etc., draw fee $4.60. And by the way, that $4.60 draw fee, that is the cheapest anywhere. And so your cost to test each patient is, say, $210. And then what are you going to charge the patient? Well, in our area, Dayton, Ohio, we charge $550 for that. Suppose you're going to sell $400 of vitamins the first 2 months at 25% profit. Made $100 there. MySure testing. and you made a minimum of $440 profit on that patient. Now also notice that we don't have an initial consultation noted here, but our doctors charge $125 for a 20-minute consultation. So add $125, right here, and that is what you would make per patient, minimum. Because there's other testing we would do that would increase that. Your time, maybe 9 minutes of your time, doctor, with your consultation, your report of findings, 20 minutes of your staff time, just doing basic, putting the report together, taking care of the rec forms, etc. Very easy to do, very efficient to do this type of work with SBN because of all the tools we have. Now here's the SBN report. I am not going to go over the whole report. It is the most beautiful, comprehensive, thorough report ever. It is patented. No one has a report anywhere near this level. Now I'm not going to go over the whole report because it's going to take about 30 minutes to do that. To really see everything, and I don't want to rush through that. I don't want to rush through all of the unique factors that make SBN so incredibly thorough. Now just to show how thorough this report is, there's a medical group contacted us earlier this year. The president talked to me and he said they have about 1,500 medical doctors that currently that they work with, and they have been looking for a report. They looked at every report that they could find. They analyzed lab work, and ours was by far the most advanced, the most thorough, the most scientific, and the most easy to read, ready to go. And we're right now in the beta testing on that. So, and he anticipates that when other medical doctors see this report and what it can do for his practice and their practice, he believes that they'll have close to 3,000 members within a couple years. So now I'm not saying what's going to happen with that. I'm just saying they see how this report is so unique and so thorough, so scientific, that this is what they want for their doctors. This isn't a report just that some chiropractor put together. This is the state-of-the-art, top-of-the-line SBN report, and it is so inexpensive to get involved with, and that's what he liked. He could get all of his 1,500 doctors involved, and it's still going to be very minimal price for the value he's getting. So again, here's where you can go and see all the details, and you don't have to be a member or anything. You can go right to there and take a look at it. All the details. So why use SBN? Why use computerized systems? Because you can't remember everything. You're going to see things in that report that there is no way you could ever remember all that. And it would take you, it's impossible for you to do a report like that. It would take you 5 to 10 hours to do a report, and it probably won't even be as thorough as that. It takes a lot of time to do it by hand. With state-of-the-art reports, you have better compliance, you have consistency, you have backup for tough cases, and we are truly the premier nutrition practice support service. It is patented. We're the only patented system. We have 2 patents on this program. It's central server based. And because it's central server, there is no software hardware compatibility issues, easily upgraded. With automatic updates, there's no extra charge for the updates, built for research and experience, and truly reports you can be proud and have confidence in for anyone to see. Now just some quick cases here that I get so excited about. Even though I've been doing this for about 30 years, more than 30 years, almost 40, I still get excited at the results I see. And here's one of my patients from earlier this year, 62-year-old male. He had a PSA of 8.7. And his wife's a doctor, and she wanted to go and have him get a biopsy and maybe do whatever medical treatment that way. I said, just give me a few weeks, and let's see what happens. Well, in 6 weeks, it dropped to 3.0. Oh yeah, that's really good. That's really good. We tested him just the other day, and it's still right there. So I know it's not a big deal. Okay, it is a big deal to him, but you'll see results like this all the time. How about this chiropractor? He is living in chronic pain for 7 years. He attended a lecture, and in 2 months, he's now off Percocet, Valium, and Narco after having pain for many years. And watch my own chronic pain lessen. I'm again testing my patient. I'm so excited to bring SBN to all of my patients. Having results yourself is phenomenal. Been living chronic pain for 7 years. Do we have a pain problem? Oh yeah. Now here, this case is so exciting too. This was last year. A young girl, 11-year-old female, complained of stomach pain for a week. Now the stomach pain was just under the ribs, diaphragm area, more on the left side, radiated to the right. And the SBM member saw this patient, but the patient, this young girl, was so bad that her family took her to urgent care, and urgent care tested her for strep throat. What? Yeah, she had abdominal pain, stomach pain, but they tested her for strep throat. Weird. She didn't have strep throat. The member asked us if any of the findings would suggest bad enough infection like appendicitis. Now our medical support team took a look at this result, and we saw ketones in the urine. Ketones in the urine, and we immediately recommended she do additional testing, a test called C-peptide and total insulin fasting, and we saw her C-peptide was extremely low, and her insulin was low. Her urine ketones were 3.0, extremely high. This girl was days from being totally dependent on insulin. She was days away from being type 1 diabetic. And within days, look, within 2 weeks, from 625 to 711, her ketones dropped to normal, and C-peptide improved from 5 up to 9. Now, if you don't know the significance of these numbers, you need to attend my lecture and or listen to my lecture online, because we'll teach you this. And this young girl, have you ever noticed, had any family, friends, or neighbors where all at once, boom, their young child, 11 years old, 13, whatever, is type 1 diabetic, like boom, overnight? It never happens overnight. But nobody is testing properly to determine where these kids are. We had a young boy earlier this year, same thing. High ketones, etc. And he had already started on insulin. And within 1 week, we had a C-peptide up like this one did. It improved almost a full point from 0.5 to 1.5, and he was off insulin because we caught it soon enough. So okay, being on insulin isn't like a death sentence, but wouldn't it be better not to be on insulin? I mean, really, wouldn't it be better not to need insulin? And isn't your long-term history and in life going to be better without insulin? Absolutely. And so here, for just a few $100s, this 11-year-old girl was saved a life of type 1 diabetes. Phenomenal. And this type of training that you'll get with SBN. How about this? Member, and I know this is a couple years ago, but MD no longer wants to do a liver transplant after 2 months on the SBM program. Isn't that phenomenal? Could we revolutionize healthcare in this country, this type of work? And his quality of life has increased significantly. Now he's gaining weight. MD's happy about that. But what would happen if we had doctors in every community doing this work, and we were able to reduce maybe we can't reduce everybody's liver transplant, but suppose that we were able to reduce it by 20%, 30, 40, or 50%, reduce liver transplants. Yeah, this is saving lives. This is what we're talking about. Or we got a regular guy here. He's got high blood pressure, high cholesterol. He's got an upset stomach, anemia, ED, mild fatigue, and headaches. He's on an aspirin, a statin, and lisinopril. People, this is 30% of the population right here. This is 30% of the adult population is this guy right here. These problems and these drugs, that's 30% of everybody walking in your office. He doesn't want to be in my office. His medical doctor says, you're just getting older. He said, and he told me, all my buddies got the same problems. So why is he in my office? His wife made him come. His wife had a serious health problem. I'm not going to go over her case, but she decided it's time for him to get tested. So we do a hair test, and we see that he's got extreme high copper. Now, what's extreme high copper called? What's the disease of high copper called? And everybody says Wilson's disease. Can Wilson's disease cause all of these symptoms? Yeah, it can. Where's he probably getting all the copper? Well, if you read his report, you'll probably see he's getting it from water. Copper water pipe. So what does he need? He's a water filter. A water filter for drinking. Boom, that's easy, okay? Go get a water filter. Now, here's his blood test. Now, and this is the panel that I was talking about that you can get for $120. Yeah, $120, you can get this. Look at vitamin D. Vitamin D's on that test. Now, vitamin D generally runs $200 to $300 if your medical doctor runs it. And you can get this whole test for less than $200. In fact, you get this whole test that includes your vitamin D and A1C and ferritin and everything else for $120. Phenomenal. But this patient is extremely low in vitamin D. Can low vitamin D cause all these problems? Yeah, it can. Can you help low vitamin D? Well, not if you don't test for it. In vitamin D, you can give somebody 5,000 Ionaceous units a day for $40 a year. $40 takes care of that problem. Now, as we move on up, we see that he has, let's see, can we scroll that thing up a little bit? Oh, we don't see it, but this fella has, oh, I'm on the wrong case. Here we are. This fella has high ferritin, and high hemoglobin. So what does he have? He's got hemochromatosis. Can hemochromatosis cause all these symptoms? Yeah, what does he need to do? Donate a pint of blood every once in a while. Really. So right there, you fixed him 80%. A little water filter, vitamin D, and donating blood. Easy, easy, easy. His liver enzymes are elevated, probably because he's on statins and blood pressure drugs. Easy. Now, we also do oral chelation in our practice. I've been doing oral chelation for probably 30 years. I probably do more chelation than any chiropractor ever. And we have many doctors that use our protocols on oral chelation. We have phenomenal results with oral chelation. And I'm not here to train you that. I have all the training you need on oral chelation online. It is for members only because you need backup. You're going to need backup sometimes for the chelation. So when we collected just 6 hours of urine, nothing showed up, but then we did a little chelating agent. We see high levels of lead and mercury. That wasn't coming out on just regular urine. He needed, and it wasn't coming out the hair. No lead and mercury coming out. So his body had an inability, or was inefficient at eliminating lead and mercury. So could higher levels of lead and mercury cause his symptoms? Yeah. So right there, we fixed him 100%. Water filter, vitamin D, donate blood, a few other vitamins here and there, and a little oral chelation, and you've got him well. And within 2 weeks, he needed no drugs any longer. Now remember, you always get consultation tips from me. My job is not to take my patients off the drugs, because if you need them, you need them. My goal is get you where you no longer need them. That's it. My goal is get you healthy enough so you no longer need them, and that's the key. So we got COVID now. Now I don't know what you're thinking about in your practice. Okay, patients aren't going to be coming in as much. You're going to kick back and relax and just hang out. And now's not the time to kick back and relax. It's not time to give up. It's time to redouble your efforts and do those things you know you should do, but maybe you've forgotten or you're just too lazy to get going. So, what can you do? Well, people are cautious, probably afraid coming into your office. Death rates in April were 6% of those diagnosed. Death rates in October of 2020 were less than 2% in spite of greatly increased positive tests. COVID and masks. Now, here's a Danish study which came out, which is causing great consternation in the medical world. You may not be reading MedPage like I do, but it has caused some consternation. And I'm not going to read this whole thing. You guys can read it. The difference in the mask versus no mask group was not statistically significant. Wearing a mask didn't make any difference. But this is what really got my attention here. Some have turned to social media to ask why a trial that may diminish enthusiasm for masks and may be misinterpreted was published in a top medical journal. And this writer goes, whoa, first of all, I am prepared to die on the hill that science means publishing the results of truthful experiments no matter what they show. We can acknowledge limits, but we can never suppress results. And I'm going to say you can't suppress the truth. Second, in today's environment, rampant conspiracy theorists watching doctors openly discuss not publishing truthful results seems to be And he says, I can't even think of a polite word. So, isn't it odd? The truth they don't want out because people think you need to wear a mask. The politicians say you need to wear a mask. And I'm not saying not to wear a mask. I wear a mask. It puts people at ease. But the thing is, the political part of not publishing science. I mean, they're always throwing science in our face, but then when we have science that shows it doesn't work, well, that's not the science that they want, isn't it? So, COVID vaccine. If COVID had a 50% mortality like some plagues in past times, then maybe I would consider. But all I have to do is be in the healthiest 90% of the population. I don't have to be super, super healthy, even though I probably am. I just don't have to be the sickest of the sick, because only the sickest of the sick die from COVID. Vaccine hadn't been studied for very long. The vaccine does not prevent disease. Low vitamin D tied to COVID severity. Again, MedPage today. And people hospitalized with COVID-19 who are vitamin D deficient experienced worse outcomes than those with normal levels. Now, let me express even more what this shows. People hospitalized with COVID-19 who are vitamin D deficient experienced worse outcomes than those with normal levels of the vitamin. So regardless of the treatment at the hospital, everything was dependent on their vitamin D levels. Patients who were vitamin D deficient experienced worse outcomes no matter what the treatment, no matter what drugs were used, than those with normal levels. Wow, hospitalized patients were inversely associated with developing acute respiratory distress, and it talks about the different levels there. Low levels are associated with higher mortality of these patients. Vitamin D is an important regulator of immune function, modulates inflammatory response. Several lines suggest vitamin D may be a risk factor of severe COVID-19 infection. A recent study suggests a patient with inadequate vitamin D levels had nearly double the risk of testing positive for 19. Previous studies also shown that low vitamin D status associated with increased risk for respiratory tract infection, and that vitamin D supplementation decreases the risk of respiratory tract infections, especially for those with low vitamin D. And we know that low vitamin D is associated with many respiratory diseases, including flu. And here in Italy, COVID mortality had been particularly high in our country, but declined in the summer months when deficiency was lower. High interleukin-6 and low vitamin D tied to COVID-19 severity. Older age, males, severely symptomatic COVID-19 had significantly lower levels of vitamin D than those with milder controls. Vitamin D levels were also inversely associated with interleukin and C-reactive protein levels, both of which were associated with inflammatory status. And interleukin-6 has been suggested as a possible marker of COVID-19 severity. Wow. In time of hospitalization, oh, excuse me, everybody. How rude is that? How rude is that? Pardon me. Vitamin D levels are inversely associated with interleukin and C-reactive protein levels, both of which are associated with inflammatory status. Oh, I already said that. At time of hospital admission, vitamin D levels were lower in the severely symptomatic group than in the mildly symptomatic group. Okay, and supplementation with vitamin D may limit the risk of respiratory failure in patients with COVID-19. It suggests a correction of vitamin D deficiency might be of relevance for reducing the clinical burden during future outbreaks. Well, I was on the radio this weekend. I'm saying instead of trying to blast a vaccine on everybody, maybe these studies are showing we ought to just give vitamin D to everybody. $40 for every American, everybody in the United States. $40 might just reduce COVID more than any drug or vaccine out there. But it's also going to protect from other respiratory problems too. So it'd be an easy thing to do. I don't know why. There are studies here that show it'd be a good thing to test, but I don't know why nobody's not. Interleukin-6, just a quick guide. I'm not going to go into all the details on it. But high interleukin-6 is pro-inflammatory, and it promotes insulin resistance, atherogenic, but basically it's pro-inflammatory, so we want it to be low. And so marketing ideas. We're going to give you right now some marketing ideas to help your practice grow, and you can implement these right now. You'll, and maybe you're not an SBN member, you can implement these, but without SBN. Let me say, with SBN, it's going to be a lot easier. a lot more productive, a lot more consistent, and you have a plan to follow. You don't have to invent the wheel again. All you have to do is get started. So the best, most, and cheapest, and probably the best ROI, return on investment, is to send a personalized letter to each patient about COVID and a new testing and nutrition work you are doing. I've got a sample letter I'll show you in just a few minutes. And that's what our doctors are doing. They're not trying to do 1,000, they're doing maybe 20 a day, personalized letter. And a lot of times it's an email, and you'll see it's a form letter, and then we want them to customize it. They go to a patient file, it's Mrs. Jones, they see Mrs. Jones had, who knows, psoriasis or high blood pressure or Crohn's disease. Ms. Jones, I'm curious how your Crohn's is doing. Hopefully it's doing better. We're in COVID season, and then it goes into the letter. Very easy to do. Doesn't take just a minute or two to do each one. And to reach a broader audience, and this is what we do too, do radio spots. And I'm going to show you the 2 ads that we've got, and also do a radio show. And I've been doing a radio show for over 25, probably close to 30 years. And a third, earlier this year, we did a 50% discount on consults adjustments like we did earlier in the year. And earlier this year, when everything was just collapsing, everybody was staying at home, businesses were just really crapping out. A lot of chiropractic practices were closed completely. Ours is still running, but I ran an ad on the radio, and we sent a big email campaign, did social media campaign, where we were providing a 50% discount for April and June only. April and June only, 50% discount on consults, adjustments, acupuncture. We could not reduce our laboratory fees or our vitamins by 50%. But by reducing it 50%, I basically said during our commercial, and you can see the script of it, we're trying to help the community in the way we can. Everybody's suffering, and so we're not going to be making much money on that. But that stimulated our other business, and we actually did better, like I said, than we did in 2019. And so we're tying in the testing and vitamins with our vitamin sale and charity. So we are doing some testing, which you're going to find out now. We're going to do some special testing for COVID. We're not testing COVID. We're going to test these other factors, and we're tying that testing in with our annual vitamin sale and charity food drive. So here's one of the ads that we're running right now. Here we go again. COVID-19 cases are getting more numerous. But as research shows, underlying diseases that you might not be aware you have, such as liver, kidney, heart, and lung disease, even cancers, could cause you to have very poor outcome when exposed to COVID-19. This is why COVID can be so dangerous to some, but not others. It is not how you feel, but your true state of health that makes the difference in surviving COVID. Blood levels of vitamin D and other specific lab tests are useful predictors of health status and how well you'll fight off infectious diseases like COVID-19. Stop guessing, get tested. At Take Two Healthcare, that's the name of my clinic, we are experts in health, wellness, and nutrition. We can guide you in staying healthy and minimizing your risk of getting really sick from COVID or even the flu. And then call Take Two Healthcare, etc. So that's one script, and here's another one. And I do like this one too. It is established people that get very sick and die from COVID have comorbidities. They were already sick, and the COVID pushed them over the edge. They would likely have survived, except their system was too weak when they got COVID. There are people with hidden conditions, maybe several minor problems that when combined can give a very bad outcome when exposed to COVID. No one who is really healthy dies from COVID. The best thing you do is to visit Take Two Healthcare for proper lab testing to assess your true state of health. You must get tested. Inexpensive testing and a few simple vitamins based on your test might just improve your health, and you will breeze right through a bout with COVID, just like several of our patients have. Don't wait, get tested now, and then call, etc. So there's two scripts, and then here's our letter to all previous and current patients. To all previous, even if they're considered inactive, if they haven't been in a year, if they haven't been in 5 years, you still need to let them know that you have an option for them. Something you can still help them with. Even if they're not going to come in to get adjusted, you can help them with this. And I'm just going to read it. Another COVID crisis is here. I have some things you can do now to reduce your risk of severe or deadly outcome if you do get COVID. Remember, we had a flu vaccine for 30 years, and reports still say that over 40,000 people die every year from the flu. I doubt the COVID vaccine is going to be any better. It is new and tested only on very healthy people. I've never taken a flu shot. I do not plan on taking the COVID vaccine either. I will trust in a healthy body. In April, only the sickest people were diagnosed with COVID, and of those, 6% died. Most of these were in nursing homes. Now we are testing many more people, and the death rate for those diagnosed with COVID is below 2%. Here's how I think. If 100 people get COVID, 2 will die. But those 2 were the sickest prior to getting COVID. All I have to do is not be one of those in the sickest 5% or maybe 10%. The problem is that how you feel is no indication of how healthy you are. We know that people with diabetes, autoimmune disease, lung disease, and heart problems are at highest risk. Recent hospitals showed that people with very low levels of vitamin D and high inflammation markers had the worst outcomes and death. People are not dying if they have optimal vitamin D levels. That is the one major factor that you have control over. At Take 2 Healthcare, we can test and find your current vitamin D levels, inflammation, and immune status to help improve your health to avoid serious COVID or flu outcomes. Here's what I recommend. 1, get tested ASAP. 4, now these are previous patients, not the general public, previous patients. Test for vitamin D, CRP, ESR, interleukin 6, remember that inflammatory marker we just talked about, and CBCs. So these test inflammation and immune status and are rather inexpensive. Buy 3 bottles of vitamin D, buy 3 bottles of zinc lozenges, 2 bottles of vitamin C, 2 bottles of SBNCC for each adult member of the family, which should get you through the winter season. Children or adults less than 120 pounds can reduce the dosage in half, but getting tested, key to knowing how much to take. Stock up on a vitamin because a few months ago, everyone was out of zinc lozenges and vitamin D. See what I'm doing there? Stock up now is what I want them to do. Right now, with good quality vitamins in stock, we're having an annual food drive and vitamin discounts, so you can save money right now. We're going to help you stay healthier, contact our staff, etc. We want you to be prepared. So that's a letter that is going out to our patients. It's a good thing and easy to do, and explains a lot of things for you. Now, testing cost. Well, I just recommended the CBC, CRP, Cedrate, interleukin 6, vitamin D, and zinc. To get all that done, right there is the price for it. So it's going to be about $160, $170 for that. You might think, well, that's a lot of money. And it's more expensive than the basic panel, the basic SBM panel, comprehensive panel, $120. Yeah, but it's got the interleukin 6 in it, which is very important, and the serum zinc. So those are factors that are very important to really help to avoid or reduce COVID-19. So if a person has low inflammatory markers and optimal zinc and vitamin D levels, it would very likely reduce the possibility of a severe or deadly outcome from COVID-19. So there's some testing we want to do. SBM marketing ideas, and we, like I just talked about, send a personalized letter to reach a broader audience, do radio ads, do the radio show. You could do the 50% discount. You can go into our materials and look at how we did that. And the script is in our materials. And we're tying the testing and driving with the annual vitamin sale and charity food drive. So I know we're going to have a very good response with that. Now here's our food drive. Agape for Youth is a adoption agency. Not adoption agency, but anyway, it's for youth, disadvantaged young people like that. And we donate the food that is provided during that time. So different, you guys can read through this, but there it is. There's a pricing form. COVID final thoughts. I'd highly recommend sending out the COVID patient letters by mail with a handwritten patient address. Studies show they get opened much more often and show a nice personalized touch. Successful people do things that unsuccessful don't, won't, or refuse to do. Now, you might not see an immediate response with these, but I know that these letters will be a benefit. Instead of just sitting home and watching Netflix, do some of these and maybe do 20 or 30 a day, 50 a day if you have time. If you really want to get your practice going, this is what you should do. Almost 40 years ago when I was in practice, Things were very slow for me when I was just starting, and I wrote handwritten letters to virtually all of my patients. And you guys should too. So we're to help, but you have to be motivated and do the work. These ideas will work. Be sure to talk to all of your patients about testing and vitamins to avoid severe COVID-19 effect. Even your patients you're adjusting right now, everybody you see, now maybe you're not an SBM member yet, but get signed up with SBN. And even if you're not signed up yet, but you're going to start talking to them about the advanced laboratory testing and nutrition that you are starting. And then sign up with SBN. We can probably get you up and running in just a few days. If you work hard, you'll be successful and withstand this COVID incident and be better prepared for the next pandemic. So start pandemic-proof your practice. Start now. So how did your practice do during the quarantine? Some things about SBN. We have automatic data entry, online patient symptom survey, electronic blood work electronic requisition forms. We have drop shipping of vitamins and other things. Easily customizable report market ideas that have worked through COVID-19, and we have special offers at the end. Now, if you wait until you feel you're ready, you're going to wait forever. One doctor that attended my courses several times, after the COVID hit, he sent me a note and said, "I wish I would have started SBN when I first found out about it, but now it's kind of crashing." And So I'm going to turn it over to Matt. He's one of our team members here at SBN, and he's going to talk about some of these things about SBN. I know this is not a short webinar, but if you're interested in becoming an SBN member, there are some very good tools and materials and things that Matt's going to go over right now that will be a benefit.
Hi everyone, this is Matt with ScienceBased Nutrition, and we're going to be going over a few things today. I might have to take the webinar down for just a moment to get into that, so bear with us if we do that. First things first, as a ScienceBased Nutrition member, we do offer something called an advanced marketing package. As Dr. Merkel's been talking about, the key to getting through this thing is really marketing and getting the word out that you're doing nutrition. This is what you can do, and this is how you can present it. We do offer something called the advanced marketing plan for all of our members. It's an additional thing on top of being a regular member. We are offering a discount, which you can see that on the screen now. That's $200 off, which we are offering to you. It's 22 full color lay lectures, which is pretty awesome. Normally those are considerably more expensive, and you get 22 of those with this, along with any of the marketing materials that you would need to get that going. So handouts, printouts, posters, everything. We do offer 4 color posters as well that get sent out along with the signing up for the advanced marketing plan, which is pretty cool. Okay, so this is the ScienceBased Nutrition website. This is going to be, I guess you could say, your hub for really everything that you'll need to be a member with ScienceBased Nutrition. The relevance of this is we have marketing materials. We have a full library full of documents, marketing videos. Basically every document that Dr. Merkel's talked about, you can find it on here. We'll take a quick look at the library now. So this is a collection of basically everything that you need to know about in order to run a nutrition practice. So anything from pricing guides, again, to marketing materials, office support materials, training on how to put reports together that we've talked about, all of that can be found in here. And we'll quickly touch on some of those now. As a member of SBN, again, on top of just regular nutrition, you're going to need to be using diets. We have some pre-made diets in here that your reports will recommend. You can actually come in here, you can print these off, put them with the report, or even modify those. We have SBM protocols as well, and we can quickly show you what that looks like. So this would be an SBM protocol, for example. So in this case, we're looking at a cancer patient. It'll tell you some tests that you should run, some supplements that you should be using, and any kind of diets or anything else that you need to be putting the patient on. Again, this is all available for all of our SBN members. It's easy to get to, it's easy to use, and it's quick. Under marketing materials, we have, which is one of my favorite things, all of our members have access to all of our SBN videos. Again, marketing is the key to getting through this COVID situation. And we have videos in here that you can use on your social media, so that's free. There's no additional investment on these. You can actually come in here. We've got a little link that you can see I've highlighted in blue. All you have to do is copy that, put it into your Facebook, and it comes up. The goal of these is to get your patients engaged and asking questions. They don't know what's wrong with them until they can start talking to you, and you can start kind of working that out with them. There is audio on these videos, you just can't hear it through the webinar service. All right, now we're looking at something called the PMA website, or the Premier Metabolic Analysis website, and this is your bread and butter. This is where everything comes together. Everything we've talked about, all the vitamins, supplements, putting a report together, getting your patients engaged, this is where all of that comes together. What you're seeing on the screen now is which is basically your portal to make your SBM reports from. It's quite simple. You can enter your patients in. We'll fill out the fields here in bold. Once your patient's entered in, you're ready to send them off to the lab. They can get the labs ran. The results will come back. And then from there, you'll be able to actually view the labs themselves. This will come right from the lab. This is all done electronically. There's very minimal input that's required on your end. Send the patient to the lab. Labs come back. You'll see the labs here as we're looking at them. And you'll be able to actually put a report together. And then once everything's done, again, this takes a minute, you'll have a complete, full science-based nutrition report in about a minute and a half, maybe 2 minutes to put everything together. It's quite simple, it's quick, and it tells you everything that you need to know, and that's the key. And this is all done electronically for you. So that's basically the gist of putting an SBM report together. That's your labs, that's looking at the materials that you have. We have training materials. We offer training as well. So all of our SBM members, they get access to the full SBM staff. We're a pretty well-trained staff in here. We're a pretty well-running machine. We could actually do training webinars similar to what we're doing right now. So if you want to have a one-on-one with one of us here in the office, we can walk you through anything that you need to know about with regards to putting a nutrition practice together, pricing on labs, putting reports together. Any questions you have, we're here for you.
And I'm back. And Matt did a marvelous job. It was kind of spur of the moment that I said, okay, Matt, I want to go ahead and just do all the those extra things that you might need to know, and just give you a better view of what all is included SBM. You're only getting a little bit, and even what Matt went over is just a little bit of all the tools we have with SBM. Really, it's a one-stop shop. We've got everything you need to get going. And you talked about the advanced marketing package, so I don't need to review that. And we are offering a 50% off for new members and reactivations. This is something until the pandemic we had never done before, the 50% discount. And it was cheap before, and it's even very inexpensive now. And if there's ever time to get started, now's the time to do it. And don't wait till you're forced to shut your doors to another quarantine. Act now, get trained, and be prepared. Because we did this for a few weeks with virtually all of our Take-Two healthcare staff working from home. As long as they're able to log in, we had them take laptop computers. As long as they could work from home, they were able to process everything at home. And so whenever you travel, if you travel on vacation, all your work is online. So it's easy to do this type of work. And remember, the special marketing we did during May and June would still be good for you here. If you want to get started, Matt really pushed, and I've been pushing too, that you got to market. You got to tell people. Because if they only think of you as a neck and back chiropractor, they're not going to equate, well, why would they even consider seeing you for nutrition? Because all you talk about is auto accidents and headaches and low back pain. Well, in our clinic, neuromusculoskeletal is secondary to all the other. We've established ourselves, we position ourselves as an expert in nutrition and laboratory. So you've got to start letting people know what you do, and you've got to start changing how you relate to your patients. So when they come in, you got to start talking to them about these type of things. And if you'll attend my lectures next year, you're going to get a ton of patient management tips. And the way you can get started now, you might have some free time over the holidays, is start listening to my SBN CEU lecture. There's 12 hours there, and you'll get tremendous training and tremendous marketing and patient management tools. So there we go. Now, if you want to get started, SBN Laboratory Training Education, read each report thoroughly. Watch 12 hours of the Science-Based Nutrition lecture, like I mentioned, and watch the SBN training videos. There's a lot of training videos material. For an advanced degree, get your CBCN. That's what I am. I'm a CBCN. Action steps, sign up with the SBN as soon as possible. Now, this next one is very important. Watch all of the doctor testimonial videos on SBN for marketing tips. These are doctors. Some are new to SBN, and some have been with us for a while, but watch their testimony because they're going to give you some of their marketing tips that got them rocketing into an incredible and being incredibly successful in a very short period of time. So watch all the doctor testimonials because they're going to talk about some of the marketing they did and also some of their phenomenal cases that they have. I mean, I've got lots and lots of cases, but it's exciting to see that they're doing the same thing now. And start talking with every patient, every visit about your new services for healthcare and nutrition, utilizing lab testing to improve health, especially with COVID-19. And what we always tell people is print out the sample report and print several copies around, put them around the office, because if you say, hey, I'm Dr. Merkel, I'm doing nutrition, they may be thinking of, yeah, the last chiropractor sold me a bunch of vitamins just because he thought I needed them. Or this guy did some muscle testing and that didn't work. But now at the lab test, you're going to know, the patient's going to know exactly what it means and what to expect. And you know what? With lab testing, nobody questions it. Lab tests are accepted at face value by everybody. And so do the social media marketing we talked about, do in-office marketing, utilize the SBM materials and videos as Matt talked about. So the 50% off for new members and reactivations, pandemic proof for your practice now. For a limited time, we're offering a one-time 50% discount for any previous or new member. Offer ends December 11th. And right there's a contact information. And SBN offers free training webinars for all members as well. And you actually can call our office right now. We have staff standing by. You can dial 208 when you hear the recording. And we do have staff in office right now. Don't wait until you're forced to shut your doors to another quarantine. Act now, get trained, and be prepared. I'd like to thank you all for attending. And if you have any questions, now we're open to taking questions. And if there are any. Matt, does anybody have any questions for us?
I haven't seen any questions, no.
Okay, all right. Well, if you do have any questions, do not hesitate to contact our staff. And Matt, we're going to make this webinar available to these doctors. If you'd like to go back and review it or get the scripts or whatever, it will be available to you doctors. So thank you for taking your time out of your day. I know it was long, about an hour. But we're here to help you. Hope you all become SBM members because I know your community needs it and it will greatly benefit your patients and greatly benefit your practice. So thank you again. Hope to see you at a coming lecture and be well and have a great holiday. I'm Dr. Merkel.